Naloxone is the one antidote known to immediately reverse the symptoms of potentially fatal overdoses. Whether taken nasally or with an injection to the muscle, when administered early enough, it is widely regarded as a miracle drug.
Naloxone saves lives, period. We should have it more widely available. All first responders should have it. Users themselves should have access to this. Their families should have access to it.
Narcan kits have become more accessible for emergency workers and for civilians through doctors and community organizations.
Many of these patients are at risk for overdosing at any given time. I think saving lives is important. So I think having naloxone more widely available is critical.
But Dr. Joji Suzuki argues it needs to be in every home where there is someone even suspected of using opioids or heroin. Dr. Suzuki says there's another miracle drug. Suboxone is a special kind of opioid designed to satisfy the craving for narcotics without providing the euphoric high.
It's able to ameliorate the withdrawal and the cravings that these individuals have. Because if you're strongly craving for this, eventually you're going to use. So Suboxone suppresses that very nicely. That's number one. Number two is that it acts as a blocker. So if you're taking Suboxone, you cannot use heroin or OxyContin or Percocet or Vicodin. You're not going to feel it.
Dr. Suzuki runs a Suboxone clinic through Brigham and Women's Hospital. Among his patients, Sandra, who after years of taking prescribed pain pills for a chronic bladder condition, eventually found her way to heroin.
My life was unmanageable. I was losing my, relationships with my family, with my boyfriend, and I was just so depressed and miserable.
She says Suboxone has allowed her to cope with her ongoing chronic pain and her addiction.
It's truly changed my life. I'm not craving, drug use. I'm not in pain because of my bladder, and, I feel so healthy and productive, and I work really hard, and I feel like my true self, so it's really made a huge difference in my life just in the past 6 months.
Suboxone is not without its critics who contend it can be equally addicting and far more difficult to quit, which is why in Massachusetts, doctors cannot prescribe Suboxone without taking a special course designed to avoid those problems. Number 16 in Wakefield, a sober house for men that prides itself on an 85% recovery rate. The answer here is not pharmaceutical. It's spiritual, and it comes with more than 80 years of success for millions of addicts. It's the well-known 12 Steps of Alcoholics Anonymous.
Towards the end, the drugs no longer even gave me the ease and comfort that they did in the first place, so.
Number 16 hosts AA meetings several times a week. Founders Ari Nicolo and David Ray discovered the AA program and each other after both had survived years of alcohol, pills, and heroin.
I was okay with the fact that I was going to die a heroin addict. I had come to terms with that, but then this was put in front of me, and it was explained to me that it's a spiritual solution. You take steps, and that brings you into a relationship with God or your higher power.
This was a new experience of inner hope and strength that I had never experienced before, and it was life-changing. I stopped fighting the thoughts, and at that point I thought, I've got to show this to other people.
Number 16 opened its doors 7 years ago. Most residents stay 6 to 8 months at a cost of $2,000 a month, far less than many other programs. That treatment is not covered by insurance, but scholarships are available.
When I got down here, one of the things that kind of clicked with me is the sense of people being okay. I didn't want necessarily sobriety. I just wanted to be all right. You know what I mean? To be able to live a day and not want to, at least not think about killing myself.
When I got introduced to this, the steps and everything, I could see hope for the first time.
I saw some people who claimed that they had gotten better. For the first time, I had seen that they were not getting high, they were sober, they were happy. And I wanted that, and I was willing to do anything I could to get that.
So there is hope. There are answers for those who have become addicted.
Dr. Suzuki cautions, though, that most overdoses, fatal, non-fatal, happen when heroin is mixed with something else, like Valium, alcohol, fentanyl.
The price of addiction, the loss of a Major League Baseball career. We'll be back in a moment.